If you are a person of size, navigating the medical community can be really intimidating. And as a person who has a chronic medical condition that often finds myself at the doctor's office, there are some practices that I've implemented that have really helped me to not only obtain the care that I deserve, but to also allow this process and these experiences to be less stressful and generally more comfortable. And the first step in this journey for me was acknowledgement of my feelings and acknowledgement of the problem. Weight stigma in the medical community is well known. There have been multiple establishments, including Harvard, that have done studies on this, and it was empowering to know that this is not in my head, that it's a real thing and it really needs solutions. And also acknowledgement of my feelings and why I was feeling this way. As a child, I was overweight and I was privy, like many of us are, to a medical provider speaking to my caregiver directly in front of me about my body, and they were speaking negatively about my body. That is traumatizing. So pairing the acknowledgement of my feelings and the acknowledgement of the issue helps you be motivated because it acknowledges the problem, and that helps you acknowledge solutions. And one of those solutions that I have implemented is I shop my doctor. Now, not only do I look at reviews, and reviews can be very telling, because if you have a doctor who has really high reviews and has a large patient base, generally speaking, they are seeing multiple body types, and they are treating those body types with respect, and that is what's leading to those good reviews. But we're going to take it a step further. I highly recommend calling the doctor's office. When you call the doctor's office, I lead with the fact that I'm a person of size, I've had some negative experiences, I'm a bit intimidated by this, and I have some questions that I would love for you to ask just to see if this doctor's office is the right fit for me. And then I proceed to ask certain questions. Some of those questions are your waiting room. Do you have chairs that I will fit in comfortably? If they don't, that's very telling. I will ask about their equipment. A lot of medical equipment has weight limits. So I'm going to ask them, can they accommodate me? If they can't accommodate me directly in that office, do they have an establishment that can? Do they have somewhere they could send me for imaging or whatever the case, if I was to need it? I will also ask, do they have any type of diagrams or posters or anything that depict overweight bodies in a negative light? Not only are these questions in themselves great to be answered, and to kind of gauge what type of acknowledgement they will give to this weight stigma, but it's also really telling if you receive any kind of pushback. More than likely, that's not the establishment for you. This also brings light to the subject. It helps keep the conversation going. And I will acknowledge that these conversations can be tough to have initially. They were for me. Now they have become, I've given myself grace. I have given myself patience. And now it's relatively simple and feels pretty good, and it will for you too. It just takes a little bit of practice, and just acknowledge that these conversations are avocation. They're avocation for you, and they're avocation for your experience, but also for the next person that comes into that office. You have done them a service as well, so it really just helps everybody. If the doctor's office has kind of passed my test and I feel good about the conversation and their equipment and their seats and all of those things, and I make that doctor's appointment, it's really important to remember that you are allowed to create your experience in that office and on your chart. And you can do this by requiring everyone use comfortable language. For me personally, I don't like the phrase morbid obesity. It is triggering for me. So I don't want that in my chart. I don't want to speak of that. And honestly, you don't even have to speak about your weight at all. If you require to just skip right past that, that is your right. And you can request that your weight not be a topic of conversation at all. That it's not included in your chart, your BMI, none of those things have to be included. It is your experience, your chart. Your doctor doesn't even have to weigh you. I know that can be a pain point for a lot of people, is being weighed every time they go into the doctor's office. That's not necessary. Unless your doctor is dosing you for a medication, or you're going to have a procedure and you're going to undergo anesthesia, you don't have to be weighed. So that can just completely be taken off the table from the jump. So between, the comfortable language and, assisting the doctor in making you feel as comfortable as possible when you do talk about weight or you don't talk about weight. If you find yourself in a position where weight talk is becoming too much and you feel like it's too much of a focus, something that I really like to ask the doctor is, what advice would you give me if I was a thin person? Complete pause. And that can really change the temperature of the room. It can change your treatment plan, and I highly recommend it. Now, of course, I am not a medical professional. I don't claim to be one, but I am a fat person seeking medical care often, and these things have really helped me navigate this. And I really want to keep the conversation going. So if there's something that you do that really works for you, please drop it in the comments. If you have a fantastic provider in your area that you think another person of size would really benefit from, please drop that in the comments and let's keep this conversation going. I thank you for your time and have a great day. Bye.